Absolutely.
Absolutely.
Yes. Yes.
In neuromuscular dentistry, we actually look at the body as a whole. We treat all of these at the same time when we treat the jaw joint, the bite, and muscles of head and neck, and facial muscles. We try to create a balance. So we optimize their function, and that relieves all these problems that the patients have.
Very interesting indeed. Now, how long would this treatment typically take, Dr. Yazdani?
Typically, the treatment takes anywhere between 3 to 6 months. We had patients that have been under treatment for a year, so I would say anywhere between 3 months to a year, depending on how far damage has been.
Yeah, but most typical patients is on average is 3 to 6 months.
And how soon after treatment begins, doctors, would one be looking at as far as having the migraines come back less and less?
It's a great question. Most people are different. Nobody comes in and they have the exact same symptom, the same scenario. Everybody's a different individual with different sets of issues. So it's a difficult question to answer. However, most of the patients, the way we look at them, we see the improvement in patients, most of them have some sort of almost immediate improvement. And from then, gradually they get better and better. Some patients obviously takes a little longer to get them.
Sure, so the migraines start dissipating and occur less frequently.
Correct.
To the point where maybe within that 3 to 6 month period that you all said is typically the normal time period. I know it varies depending on each patient to the point where they completely are gone.
Right.
Exactly.
Now, as far as results go, what is one looking at? Obviously, the migraines being eliminated. Anything else along the results line, Dr. Yazdani?
The results are just amazing. I mean, these patients are rejuvenated and revitalized because it's very life-changing. Because imagine they have been in pain for many, many years. They have suffered from pain which they had no answer to, and all they could do is just take medications. And the type of treatment that we are offering them, it completely changes that. As you we'll see with the patient that we're interviewing, you can see how her life has completely changed.
And the greatest thing with neuromuscular treatment is that it's non-invasive. There is no surgery, there is no medication. And we just basically, by aligning everything, allow patients to heal. Their own body heals itself, essentially.
And you know, that's significant because what I've gathered thus far as well from what you both have enlightened us with here today regarding neuromuscular dentistry and how it can eliminate migraine headaches is that prior to this procedure, this treatment, I should say, neuromuscular dentistry, from what you just said, Dr. Yazdani, a few moments ago, people take medication, which means they're basically taking pain relievers, which is like putting a Band-Aid on a cut or a sore, but unless you're going to get to the sore and the cut and actually fix it, it's just an ongoing thing.
Exactly.
And there's no relief in sight. And until neuromuscular dentistry and the advances that you both have thus far educated us on today came about, there was no real remedy until now.
Exactly.
Exactly. So this is basically treating the cause, not the symptoms
That's
anymore.
right.
And by eliminating the cause or improving the cause, patients feel a lot of relief.
Now, let me ask you, Dr. Mortazie, are these results permanent, or are we looking at something here where a year, 5 years, down the road, these migraines can start coming back just when we think we've gotten rid of them?
Neuromuscular dentistry has 2 phases. Phase 1 is to get rid of all the symptoms and alleviate the pain. Once the pain is gone and they're comfortable, we follow the patient up to make sure they are stable. That's phase 1, which is still diagnostic. Once that phase is done, patient is comfortable and they feel good and they're stable, then if they want to make that change permanent, they can move to phase 2, which is making that change permanent, basically.
Okay.
And at that point, they are good.
They're good to go.
They're good
they
to
don't have
go.
to worry about that.
They're good to go. We recommend, however, that they come back every 3-4 months just for a regular visit, just to make sure everything is still stable and they're still doing well. As you know, things can happen in life. You could have accidents, all types of things that can change some permanent thing to something that's not stable.
You're right. No, very good point, because the alignment that was corrected through this neuromuscular dentistry treatment can be undone, for instance, if they're in an accident, God forbid, or something along those lines that
Correct.
threw the alignment off.
Exactly.
We're now going to meet a patient and her husband.